My name is Dr Thomas Crabtree. I'm an ABCD Research Fellow working at the University of Nottingham in the United Kingdom. I'd like to thank you today for listening to this poster presentation where we're looking at real-world glucose and weight outcomes associated with oral semaglutide with the results derived from the ABCD audit. These are my disclosures. So, many of you will be familiar with the ABCD audit programs which run in the United Kingdom and some of them in fact worldwide. And the ABCD Oral Semaglutide audit launched in 2021. The aim of this audit was to collect real-world routine clinical data on the use of oral semaglutide to see how outcomes from randomised controlled trials translate into a real-world setting where we know individuals with more extreme characteristics may use the drugs, who were perhaps excluded from randomised controlled trials, or where their situation is less well resourced without constant appointments with research nurses and the like. The data is collected by centres that are participating using a secure online tool held within the NHS systems. Just to recap on what we know so far about oral semaglutide, you will all be aware that semaglutide is the first GLP-1 receptor agonist available in an oral form. We already know from both randomised control trial and real-world data that both injectable semaglutide and oral semaglutide are associated with HbA1c and weight reductions. If we just think about the Pioneer trials, which were the randomised control trials for oral semaglutide, these showed significant HbA1c and weight reductions, with a HbA1c reduction of 1.4% and weight reductions of 2.6 kilograms. For this assessment of oral semaglutide, we looked at the outcomes of HbA1c and weight and included all individuals with available baseline and follow-up data for one of the outcomes of interest. For the analysis, we used a multivariate linear regression analysis to correct for any changes in covariates and for baseline characteristics. The results are on screen at the moment. You can see that the HbA1c reductions observed in the real world were slightly less than what was observed in the randomised controlled trials, with a HbA1c reduction of minus 0.7 between baseline and follow-up, but the weight reductions seem to be slightly bigger, or certainly in the same ballpark, with a weight reduction of 3.3 kilograms seen between baseline and follow-up. You can also see the baseline characteristics on screen, and you can see here that this is a very slightly different cohort to what was in the Pioneer trials, with individuals having a higher baseline weight, but also a higher baseline HbA1c level. If we were to look at recommended HbA1c targets and the numbers achieving these at baseline and at follow-up, this essentially doubled from 14.3% achieving a HbA1c target of less than 7.5% to 28.6% at follow-up. To conclude, oral semaglutide is associated in this analysis, this real-world assessment, with reductions in HbA1c, reductions in weight, and increased numbers of individuals achieving recommended HbA1c targets. We're going to continue to collect data, and there's going to be a need for ongoing surveillance of outcomes in the real world so we can better understand how that randomised control trial evidence translates into clinical outcomes in the patients that we're looking after in clinic. The other things that we're interested in looking at using our data set would be perhaps be dose response, but there's also some interest around people switching between oral and injectable semaglutide, especially with there being varying supply issues with these medications that have perhaps necessitated these changes. We'd like to take this moment to thank all ABCD audit contributors, but particularly those on screen at the moment who've contributed to the oral semaglutide audit. If you'd like to learn more about the ABCD audit programs, please don't hesitate to reach out to one of us, and we'd be happy to take any questions.